This is Dr. Melissa McCrae, and I'm excited to introduce you to the elimination diet portion of your journey. This is an extremely important part of the process, and it's really a food first type of approach to what's going to be happening. So let's dig in and find out exactly what we're working with for the elimination diet. When people have symptoms or conditions that have failed to respond to conventional therapy, we use the elimination diet because, again, it's a food first type of approach. It actually helps identify if food is an underlying root trigger or possibly a mediator of the different disease processes we're trying to work through. So if foods you're eating are a persistent irritant to your body, it triggers your immune system. And if that is continuing to happen, you are very unlikely to heal. So lots of different foods that are eaten frequently can be causing a long list of health conditions. We think about digestive problems, of course, headaches, sinus drainage and congestion, low energy or depression, mood swings, all kinds of skin irritations. We have joint aches and pains, which is one thing we hear quite often. Asthma, weight gain, which again is another key issue for many people, and of course, many other symptoms. So you'll see from this list here, we have gastrointestinal, which is anything from your mouth to your throat and swallowing, stomach, intestinal tract with bloating and gassiness, all the way down to constipation and diarrhea type issues. Of course, all types of skin issues, respiratory, which is how you breathe and your oxygen exchange. And then we have all these other subjective type things like irritability and difficulty sleeping, headaches, migraines, fatigue. Those are all types of things that we can very commonly relate to many different types of food intolerances. When you think about why exactly you're going to be doing this, well, there's a couple of key factors that I want you to focus on. Again, the first thing we're going to do is try to identify different food triggers that play an impact in your health. The second one is reducing inflammation. This is so critical. So if we take away the irritation that's happening in your intestinal tract, what we do is we're actually decreasing those different antibodies called IgG antibodies that trigger reactions. So simply by doing the elimination diet, we can decrease your IgG levels that are related to inflammation. We can reduce toxic burden on the liver. So that's a wonderful supportive measure that we can use there. We're supporting your healthy gut microbiome. In fact, the elimination diet has been found to be one of the best things to stimulate your gut bacteria. This is going to be crucial as you continue to find through your journey. This diet is loaded with phytonutrients that help heal the gut. There is, of course, no calorie restriction, which is another wonderful approach. That when we call it the elimination diet, we're really referring to a way of eating. This is not a weight loss program. This is not with any kind of intention to lose weight. If, however, a metabolic issue is causing your weight retention, then certainly you will see some weight loss. And the last thing is we're really trying to promote the body awareness to food. And what that means is when we reintroduce foods, you will find there are direct connections to how your body feels when you eat certain things. So this is going to be very important as we do the reintroduction phase. So you'll be receiving an elimination diet handout. It's going to look something very similar to this. And it goes through all the different listing of foods we can eat, different serving sizes and portions. We will specifically and personally match this up to exactly what you should have. You can tell that there's a couple of orange dots on there, and those are high histamine foods. There's some green squares for fermented foods, and you'll also see some triangles, which are more in relationship to nightshades. And we're going to get to that part in just a minute. So let's start talking a little bit about the different varieties of foods, and we get a lot of questions on exactly what foods to eat. So let's get right into that. As far as vegetable goes, all vegetables are allowed. You can have them raw, steamed, sauteed. If you find that you cannot tolerate raw vegetables, then find another way to eat them, because we just want to make sure that you're getting plenty of vegetables in. Typically, we're looking between 6 and 10 servings of vegetables a day. Now, an exception to that is sometimes people have significant arthritis issues or joint aches and pains. In that case, those folks might benefit from cutting out nightshades, and those would be potatoes, eggplant, all types of peppers, whether it's green, red, yellow peppers, hot peppers. So we'll get into that very specifically on a person-to-person basis if we feel it's important for you to cut out the nightshades. From a fruit perspective, typically 1 to 2 servings is pretty normal. Again, you'll see on your specific elimination diet plan what your allotment is going to be. So these can be fresh or canned in their own juices. Make sure that they're BPA lining free cans. They can be cooked, poached, or dried, but if they are dried, make sure they're not sulfured. Frozen is fine. Of course, different times of the year and different places where we live, it's important to have access. And frozen fruit can be that option for us. And of course, different diluted vegetables, being very careful about the sugar component to that. Some exceptions, if we are concerned about candida, we will be limiting your fruits during this time frame. So how about grains? A lot of people have questions about eating grains. We're actually pretty much okay with rice, so the non-gluten grains. Rice in particular, brown, white, basmati, jasmine, red or black rice. If you want cereal, then rice puffs. If you want a snack that's something crispy, rice cakes or rice crackers. And even from a pasta-based perspective, we can do some rice noodles. So we can stick with the rice. Make sure you're rinsing your rice really, really well, because we know that contamination with arsenic is very common. So make sure you rinse that rice really well before you do use it. We do have a few alternatives, and these are your gluten-free grains. This would be quinoa, which is actually a seed, millet or buckwheat, amaranth, teff, and tapioca. If there are any changes to this, again, we'll go over those specifically with you. So from a comprehensive elimination diet perspective, this is a nice little summary. There's going to be things that you're going to want to avoid. And you're going to find those on the left in the red: alcohol, beef, chocolate, sugar. You know, a lot of these people will say, can I have just 1 cup of coffee a day? It's really, you are going to get out of this what you put into it. So at this point, in the beginning, absolutely don't compromise on your health. You are seeking to accomplish really amazing things. So let's just get it done. So we are going to avoid the chocolates and sugar, coffee, soft drinks, teas that are caffeinated, corn products, as that is a grain. We're going to cut out the dairy and the eggs, grains containing gluten, peanuts due to the processing and the actual molds that those expose us to, processed meats. We're going to cut out the pork and the shellfish initially because of the heavy metals, and soy-based products. So there are so many things that are left for us to eat. We have our dairy alternatives like coconut milk and almond milk, lots of fish and fruits. Of course, we have game meats, gluten-free grains, lots of different healthy oils. We are going to do legumes, just again, not the soy and the peanuts. We have lots of other nuts we can use, poultry, seeds, and of course, so many vegetables. So let's talk about those people who are a little sensitive to nightshades. These are the people that, again, are joint ache and pain people. Nightshades have something in them that are alkaloids, and they make you a lot more susceptible to inflammatory reactions with IgE. So after eating some of those nightshades we listed off before, it's not uncommon to have some skin irritation, itchiness, even some nausea. Inflammation and muscle aches and pains are definitely what we see the most. So we're going to cut those out in the beginning. We're going to heal the insides and really work to tackle these issues, and then seek to reintroduce them later. So here's just a little more listing of some of those common nightshade vegetables. Certainly peppers and white potatoes, I would say, are the biggest thing that people most notice. So watch out for those. Peppers, when you're thinking of that, of course, it also includes the paprikas, the cayennes, and the capsaicins. So if you want to do a little bit of substitutes, we do have some ground white pepper that is totally fine, and ground black pepper. You can use lots of different tomatoes or substitutes for the tomatoes. So beets and carrots, often you can make something called tomato sauce, and we can have recipes for that to share with you. Bell peppers, you know, you're really looking for that kind of crunchy, almost sort of sweet flavor commonly with that. So celery, radishes, and zucchini is a good alternative. For white potatoes, of course, we have riced cauliflower and mashed cauliflower, which does a lovely job. And sweet potatoes is go-to for so many people. Now, before you actually get started with your elimination diet, there's a few things that we're going to have you do. And the first one is you are going to fill out a medical symptom questionnaire. And this is going to be immediately before you start the elimination diet. This is going to be very, very important, as again, we do a lot of symptom and disease tracking with this form. So we have a lot of information put together for you. We hope you find useful. We actually have a 7-day elimination diet menu that you can refer to. I'm going to go over a few things you're going to have to watch out for as far as possible reactions and things to kind of keep an eye out for. Make sure you prepare your kitchen. You know, if you know you are a sweet person, then go through that pantry and just really prepare yourself for success by removing those things that are not going to be part of this initial process. We want you to avoid real strenuous activity for the first couple of days. You know, your body's going through an adjustment, and depending on who you are and what you've been doing, we want to make sure there's a really great focus on getting started in a really great way. If you've been given any types of nutritional supplements that are necessary, or if your health requires any medical grade food replacements, then it's very important that you get started on those as we begin the program. So let's just touch base on a couple of different reactions. There's something called a Herxheimer reaction, and this typically starts between 6 and 10 days into the program. It can be a feeling of simply just some fatigue and headache, almost like a flu-ish type symptom, but it can be really significant with nausea and just really overwhelming fatigue. If that's the case, please reach out to us and let us know. We do have some ways to kind of help you through that. That typically lasts about 24 to 48 hours. You can use some natural anti-inflammatories like curcumin. We might give you a binder like charcoal, and sometimes we'll actually buffer the system to help you get rid of some of those those just natural type of endotoxins that are being released, and a good buffer is Alka-Seltzer Gold. But just call and let us know, and we can walk you through if you feel like you're getting a Herxheimer reaction. Hypoglycemia, this is something we don't normally see, but certainly can happen when people really restrict and limit their foods, especially if they've been a really high carbohydrate intake person and they're making this transition. It can kind of rock their system a little bit. So watch your feelings. Hypoglycemia, if that's the case for you, you might feel lightheaded, you might feel shaky, you might feel clammy to your skin. If that's the case, make sure that you're keeping some fruit around so that you can simply try to supplement with that to bring your sugars back up a little bit. Proteins and fats will help stabilize those insulin levels to keep that from happening. Again, please reach out if any of these things do occur so that we can help you through those. From a GI perspective, GI problems, sometimes people get a little bit bound up. Changes in your diet can affect your bowel movement. So sometimes we see some constipation. High fiber is wonderful, and you should be getting that out of all of the vegetables you're going to be eating. But if not, we might recommend you take a fiber supplement. Some really wonderful fibers include a prebiotic and a probiotic. So we have some great go-tos to help things move along. One is called OptiFiber, and that's available through our Whole Scripts website. Chamomile and peppermint teas are wonderful to help soothe the stomach if you have a little bit of stomach upset or a little nausea. Magnesium if we need to, and some vitamin C. Vitamin C does a great job of kind of moving things along through the bowels as well. If you're having some cravings for sugar or you're having those caffeine cravings, buffered vitamin C can do a really nice job. We typically are going to recommend you taper down on your caffeine slowly, so it doesn't have to be necessarily a cold turkey type scenario with that. So make sure you talk to your provider if you have caffeine in excess of 2 servings a day. And of course, the weight loss. So this is something that can happen as that inflammation is released from your system. However, if your calorie intake is significantly lower than normal because maybe you're not sure what to eat or you don't know what to do next, then please make sure you give us a call. If anybody is losing more than 5 pounds initially, we want to know about it so we can keep tabs on that and watch you very closely. So weight loss is the other. So hopefully this has been really helpful for you. Again, just some key points about why we do the elimination diet, why it's so very, very important. And you can look for further information. We're going to be sending you lots of recipes. They'll be coming every week. And we are always here if you have any questions. So make sure you reach out if you're having questions. We'll talk to you soon.